Good evening, everyone. Welcome to Pleasure Pulse. You're tuned in to another episode. We're live on ZIZ on radio, on Facebook, and on YouTube. And I'm so happy to have you here with me for another Tuesday, another conversation about something related to sex, sexuality, our bodies, and so on. As usual, before we get into tonight's discussion, I like to give you all a few to gather yourself and gather the troops to let everybody know that Pleasure Pulse is live. So we will take a short break and then come back and get into tonight's discussion. So stay tuned. Good evening and welcome back to Pleasure Pulse. I'm your host, Roma Richardson, and you are tuned in to ZIZ Radio, ZIZ on YouTube, and ZIZ on Facebook. I am so happy to have you with me here for another Tuesday. I always look forward to these conversations because even when you have a topic, you never know fully where the conversations might go. And you also never know what you might learn about somebody. So I have had a number of guests come on this show, and I think for some of them, we get to see them in a different light, hear from them perspectives that we don't usually get from them. And I like to draw that out of people. And that's not to say that that's what's going to happen tonight, not to put my guest on the spot. But I feel like it's always good to see people in this space, especially if people work in specific fields and we don't always get to see them or hear them in more public fora. So I'm very happy to have my guest introduce herself tonight. I allow my guests to do their own introductions because I want you to tell the people whatever you want them to know about you. Maybe something secret, maybe something special, maybe none of the above, and just your name and profession. But here's my guest. Please introduce yourself.
Good evening. My name is Dr. Joanne Matthew, general practitioner, and I am happy to be here back again with Roma on Pleasure Pulse to discuss more about sex plus.
Plus. I mean, perhaps you've seen the flyer at this point. So we are talking about sex and hygiene. And it was so interesting because I thought about the topic prompted by a Facebook discussion that I saw, which I feel like, it comes up every now and again, like somebody talking on Facebook or posting on their WhatsApp status about hygiene specifically, and specifically like smells and odors. And I was like, oh, I want to find someone who I could have a decent discussion about this with. And I was like, why don't I reach out to one of my favorite doctors, Joanne? And then turns out we had a similar discussion about this already, and I was like, we could keep going because obviously, the fact that people are still talking about it, it means that there is still space to continue the conversation. So thank you for agreeing again to come on Pleasure Pulse to talk about sex and hygiene.
You're welcome.
Yeah, and of course, the conversations that we have here are not meant to shame, they're meant to educate, and they're meant for especially if you are in a position where something you hear resonates or you feel like you might be experiencing something along the lines of what we're talking about, it's for you to be able to seek help or seek next steps, do more research, whatever it means for you. So tonight we are talking about sex and hygiene. Now, as I said, I've seen some critiques online about people's, particularly women's, body odors. What would you say, just generally, causes people to smell the way that they do? And what should people typically smell like? It's a very strange question.
Not necessarily.
Okay.
I mean, I have realized that some people are sort of obsessed with scent and smell with regards to private area, women's genital area. And, I've noticed this over the years, and I think I expected that as years passed and, social media, information, the internet, that, people will become more educated and, some of the myths, some of the things that they say wouldn't, be as popular. But that's not necessarily the case. People still talk about it. And so, but with regards to what it should smell like, I think one of the myths is that, the female genital area shouldn't have a smell at all.
Mm.
And that, some people say it should smell like roses, for example, it should smell pleasant.
Yeah.
But not necessarily. But at the same time, it shouldn't have a terrible smell. It shouldn't be turned off by the smell. There is a distinct scent to it, but it shouldn't be a bad odor. But it may not necessarily smell like nothing, and it definitely may not smell like roses or perfume. So that's the first misconception, or first myth, I guess, with that we should clear up. That for most persons, they do have a scent, and it's okay if you have a scent. That's your regular scent. But a very, very bad odor is a cause for concern.
Mm. Okay, so everybody has a unique, you would say,
Yes.
scent
Yes, I would say
that is determined by like your unique makeup, your unique organisms and stuff that live on your body, things like what you eat and so on as well.
The diet doesn't really play a big role in the scent, but you are correct that we each have our own unique scent.
So, okay, so if you pay attention, or if you are, I guess typically smelling yourself, the way that we're talking about it sounds a little strange, but, like sometimes I do be like, just to see what things smell like, as well as sometimes you might smell your genital area just to see. Just like sometimes you might look at it just to see what it looks like. Sometimes you might smell it. So people have their unique smells. So don't expect everybody with a vagina, don't expect their vaginas to smell the same. And don't expect them to smell the same.
Correct. And it may not be completely scentless either. It shouldn't blow you away, but it does have a smell, usually.
Okay. And things like, for example, notice when you exercise, when you are sweating, when you are doing a lot of movement and things like that, or when you are on your period or after your period. Would that affect what you smell like?
Right. That can change your the scent down there. So, yes, when you're sweaty, during your period, for example, as you urinate throughout the day, pass urine, all of that, all throughout, these are different things that can affect the scent temporarily.
Okay, so it should return to what you typically...
After you clean up and wash up, you should notice your regular scent.
Okay. And what about people with penises? Because I think a lot of times these conversations center on vaginas, and it's related to misogyny, vagina hate, and things like that. But people with penises can also, have their penises smell. What is like the regular or typical or healthy smell of a penis?
It usually smells just like the person. It's not like the vagina that has an opening inside that is usually moist, that may hold on to odor longer. But they may have a natural scent that is affected by hygiene as well, sweating, the type of clothes they wear, how often they change their underwear. You when they urine as well, that may also affect the scent.
Mm.
But generally, is not as distinct as the vagina or the vulva would smell
Mm-hmm.
in comparison.
Okay. It just kind of typically smells like skin.
Right,
But
just like the
sometimes,
person.
but sometimes penises do have odors. I just want to insert
Yes.
that there. Sometimes penises
Sometimes they do.
do have odors, and that if it's atypical for you, could also be a sign
Indication
that you
something is going on.
yeah. Okay. All right. So I know that you're a general practitioner. But I would love to hear about some of the reproductive health concerns that you have treated, in your work, specific to like in the context of what we're talking about. People reporting odors and things like that.
Right. Okay, so the usual in terms of scents or vaginal hygiene, or sometimes it could be vulva, the part outside, not necessarily the vagina that's inside. You typically get infections, the top three infections. Yeast infection is very common, especially for women who are not even sexually active. And then there's bacterial vaginosis, which is basically an overgrowth of bacteria in the vagina. And then there is trichomoniasis, which is a small parasite that usually is an STI. So those are the top three infections that cause changes in a woman's vaginal discharge, as well as scent. So there are other causes, other common STIs like chlamydia and gonorrhea that may affect the scent and the discharge from the vagina. Sometimes things like herpes as well could sometimes cause a discharge, and sometimes bumps on the genital area as well. So those are typically the ones that you may notice the scent, the look, the feel of the genital area. You may notice significant changes with those.
Okay, and you mentioned that things like yeast infections are common. So
Yes.
I'm glad that while we're going through this, we're also addressing and dispelling myths, because I remember, people being especially scorned when it was found out that they had a yeast infection. Like perhaps, they were intimate with somebody and the person noticed that and went and told the world about it and things like that. But you say that it's common, and you also say that it can happen in people who are not even sexually active, so it's not necessarily related to sexual activity. It's something that happens, right? I was gonna ask, how sensitive is the vagina? Is the vagina big? But yeah, but you can answer. Yeah, you can answer.
I think it can be for some persons quite sensitive, and some people more sensitive than others. We usually try to encourage women to wear underwear that have a cotton lining, because it absorbs. It can absorb moisture a little bit easier, because those with the synthetic fibers like polyester and stuff, they tend to cause more irritation and could possibly increase the risk of things like a yeast infection, for example. They trap heat, they don't allow air to pass in and out like cotton would.
And they hold on to moisture.
Right. So some women may notice, just like with anything, whether it's respiratory system, some people are just more sensitive and to allergens. So you two persons may wear this exact same underwear, and one may develop a sensitivity or an allergic reaction to it. Is it in the same way that when you're using soaps, for example, some people are more sensitive to certain ingredients than others. So technically, you can say that, maybe not for everyone, but for some persons, the vagina can be sensitive.
Yeah, I mean, I absolutely 100%, agree. I My experience has been that, like anything can throw off the pH, right? And cause a yeast infection, cause discomfort, cause some difference in, what you're accustomed to, right? So for me, it's like the shame and the attitudes towards vaginas are so unjustifiable, because like sometimes literally anything can cause a change in your discharge, a change in your odor, like, and sometimes it's not anything that you necessarily did. Sometimes it's something that you ate, sometimes it's something like a change in the environment. Sometimes you're trying out different underwear, or sometimes you happen to just stay longer than usual in your gym clothes, right? So like my experience has definitely been that like anything can cause it to go
Right.
right. but
Right.
but yeah, that might not be everybody's experience, but I think it's definitely helpful to be mindful that that is some people's experience,
Experience.
right? Like for some people, like despite their best efforts, like some people are dealing with things like chronic yeast infection, some people are dealing with chronic BV, some people are dealing with some things that they are trying to get treated, and they're
It's
really,
difficult.
it's difficult, and it can be difficult sometimes. And yeah, I have definitely like experienced some of that difficulty at different times, and
Right.
it's it's hard,
It is
because
hard.
like, and that's why I wanted to talk about it too, right? It's like you on the internet like talking about how people smell. A lot of people are conscious of those smells and are doing a lot of things to try to address those smells, sometimes things that can worsen them. So I also wanted to touch on things like douching. So douching, feminine washes, those are oftentimes recommended for people, either experiencing certain issues, or recommended as preventative measures for certain issues. Tell me why. I mean, based on what I've read, everything suggests that we should really avoid douches for sure.
Yes.
Feminine washes, it's kind of,
Not
yeah.
as hard and fast
Right,
rule.
yeah. But tell us why we should avoid douches.
Right. Because, well, first of all, for those who don't know what douching is basically trying to clean the inside of the vagina, that part, where, you know, for example, menstrual blood comes out, where the baby comes out, the in deep inner part of the, the genital area. So some people would try to put water, soap, fancy liquids that they buy that are supposedly supposed to help to clean out the vagina. But the truth is that the vagina is, we call it self-cleaning. It cleans by itself. You don't need to necessarily go inside and clean it out, because a lot of the times these chemicals, they tend to make it worse. They tend to, as you say, it may affect the pH balance, or it may introduce things like other bacteria and stuff into the vagina that don't belong there, and can basically create severe allergic reaction, or even an infection. And so not only is it unnecessary, but it can be detrimental to the vaginal health and your overall health. So we don't recommend it. And some people don't only use fluids to try to clean up in there. Sometimes I've heard of people putting things like garlic and different things. So it's not just douching in terms of putting the fluids up there, but anything up there, that in terms of just leaving it there to try to clean it out is unnecessary and may even make things worse.
Yeah.
So,
And what about feminine washes?
So the
So I know
feminine-
that's like, yeah, kind of
right.
up
So
in
the
the air.
feminine washes, they generally are more for the outside, which is the vulva area. So depending on the ingredients, some of them may not be as bad, but every woman is different, every vagina, every vulva is different. So some people may be able to tolerate some washes than others. In the same way, just your regular bath soap that you use to bathe your whole body, some people may be able to tolerate those over others. But generally, we recommend for your cleaning down there that you use soaps that are very mild, very gentle, and usually don't have much fragrance or other, ingredients that may irritate the skin down there. So I wouldn't necessarily recommend any brand that's better than others. You usually don't necessarily need feminine washes, but some people find that they can be very helpful. But the thing is, what may be good for somebody may not necessarily be good for you. So that is, where we at in terms of feminine washes.
Yeah, and there are no masculine. Well, I haven't heard of any masculine washes, and I don't mean Axe.
That
I
is so
mean
true.
washes for penises, because some penises be smelling, right? Like,
Some
whether
of them
it's
are very unclean.
yeah, and some of in terms of washing properly, because knowing how to wash properly is important. So if you are uncircumcised, knowing that you have to push your foreskin back and clean properly, not soaping up necessarily down there with, but it comes back to what you said, right? Like for some people it might be okay, for some people it might not be okay, like washing with Irish Spring the head of your penis and things like that. I always think about it, I like to think about it in terms of sex, because the same way that, we talk about not using certain products inside of the vagina, I'm mindful of men using products on their penis that is maybe, they're going to have sex or whatever, and introducing, those products, those fragrances, sometimes heavily scented products into a vagina. Sometimes it's something like that, that causes an issue, for the woman, right? So I would like suggest, the same way that we talk about gentle and mild cleansing soaps, like simple soap. I like simple soap. It's pretty neutral,
Right, that's a good
smelling.
example.
Yeah, very mild, and I feel like can be used for everybody, because it's nice to smell nice, right? But I think that body washes, especially ones with fragrance, are for other parts of the body and not, penises or vaginas, nor like anal areas and things like that, because those parts of you have their own like natural smells, right? And they're gonna smell like what they're supposed to to smell like.
Yes.
Yeah, so that's my little, anti wash
Okay. Yeah.
introduce masculine wash.
I agree with like we can talk just a little bit more about um, washing and cleaning for the penis for male reproductive male genitals because sometimes it can be a problem in my practice. I've noticed it may not be a problem so much with younger men. They may take a little bit more pride, maybe because they're more sexually active too. But some of them are young and don't realize that they really need to put a little more effort into making sure down there is clean. But definitely, I've come across a lot of older men who sometimes they get sick and you have to be the one dealing with them, and you can tell it hasn't been properly washed in a very long time, especially those who are uncircumcised and you have to pull back the foreskin, and that is a risk for infections and a lot of different problems. So while we are also talking about how women we must make sure they take good care of the vaginas, wash regularly, just to point out to the men too that it's also important for you to take care of your genital hygiene, making sure that you pull back, clean properly, because that collection of germs, especially if it's introduced into the woman, into a vagina, can trigger some serious infections.
Yeah. I just no, I mean, I also like intentionally titled the show just sex and hygiene. So while people talking about women's hygiene and women's sense was the
Focus.
yeah, like the impetus or the prompt for the conversation, I definitely wanted to talk about penis hygiene and men's hygiene as well, because I think that is like I don't want to say it is neglected. I don't want to say hugely neglected, but it's not something we talk about enough.
Regularly,
Like
right.
the shame that women get, men need to get.
Right.
People with penises. Just kidding. But I mean, like, it's also like the things that men do, So it's like you could be walking down the road anywhere and you are bound to encounter a man, on the side of the road peeing somewhere. There's no hand washing, there's no wiping, nothing, right? You also sometimes have, people who use the bathroom, they flush the toilet, they don't wash their hands, they go touch people and all sorts of things. They're eating Cheetos and then they go touch, they go touch, they come go touch you with their crumbly, the crusty, dusty hand, and then they're gonna ask, "Oh, what's that? Smell like?" It's that, like that. So it's like there are so many, and that's why I really think that it's important, especially for heterosexual couples or for people who have sex with people of the opposite sex, to be careful about how you are treating your own body and your own hygiene practices, because those might very well be affecting somebody else's health and hygiene. So it's like it might not even affect you. Like you might not have a reaction to it, but it is causing a reaction in the other person. So like, yeah, I just wanted just really wanted
Yes, very important.
to put on my to talk about that. So there are, people talk about like strong, fishy scents, offensive kind of odors. What would you say are odors that are cause for seeking medical help? And are there other symptoms that people should look out for, like in addition to the odor or separate from the odor?
So apart from the odor, a change in your vaginal discharge is a red flag. um, bumps on the genital, red flag, bleeding, especially for women outside of the period, severe pain during sexual intercourse, and bleeding after sexual intercourse. Um, so I think those are the most common ones. As you say, discharge and scent. You have to know what is your normal so that you can pick up what is abnormal.
Yeah.
And looking at your genitals, especially for women, to properly see it, it's good to get a mirror, whatever position you want to take, and just look. Sometimes, when you clean yourself in the shower, you may not get everything, and so sometimes it's good to open and look, observe. That is how you're going to notice, hey, I've noticed little changes here and there. So look, and so that you can pick up changes. Observe the scent so you can pick up changes, and observe your discharge, because some people have a normal discharge every day. Some people have no discharge at all. So when they see a discharge, it's a red flag immediately. But some people have a discharge every day. We call it a physiological discharge. Meaning there's nothing wrong. It's just something that's a discharge that's coming from the vagina. But they may notice a change. It may be a change in the amount. You get to see more. It may be a change in the color. So you may notice it used to be clear, transparent, like water. Now it's whitey. Now it's green. Now it's yellow. Now it's bloody. And change in the amount, in the color, and in the scent of it. So once you know you're regular, then you will notice something that's irregular, that's abnormal to you.
Joking.
Take your time. Take your time.
Joking. I wonder if that was. Okay. Indeed, but it was just I just swallowed.
Sort some ear.
I swallowed. Wait. Is it live? Joking. I wonder if that's the universe telling me not to say what I was about to say. But I wasn't going to say. I wasn't going to say anything like that. In fact, no, I don't even remember. No, I don't even remember.
It was a sign.
Yeah, we were talking about, what is your regular noticing your regular discharge and what might be irregular for you. And I was just going to say, because there's so much, and I was thinking about this, on my way to the show. So there's a lot of stigma, around sex and talking about sex and things like that. And that stigma also applies to the bodies and parts of our bodies that we use for sexual activity, including the vagina, and how the shame that's attached to women's bodies, particularly our reproductive health organs, our vaginas, and so on, prevents us from being in tune or attuned to what's going on with our vaginas. So it's like some of us are afraid to look at our vaginas. Some of us have never looked at our vaginas. Some of us think that I just
you don't have anything to
do with what's down there, and it's like a lot of times you pick up things, you learn what's happening with it from your partner, when you are in the process of sex, or when they're looking at it, or when, whether it's oral sex, whatever it is. And we have to be in tune with our whole bodies. So I like to, when I'm peeing or whatever on the toilet, that's your opportunity to look at what comes out, when you wipe. That's your opportunity to see if you take a scent. That's your opportunity to look down and do like your little investigations or whatever. Same thing when you're showering or when you're bathing, right? And you are cleaning yourself properly, because I mean we kind of touched on cleaning yourself properly. You talked about like, you know, for people with penises, like pushing back the foreskin and so on, but also for people with vaginas and vulvas, pushing back the head of your clitoris and getting in the crevices and so, not with soap, you know, but with warm, well, if soap, mild soap works for you, you can use mild soap. I feel like the closer I get into and the more I'm getting into folds and things that like cover over, is the more I go into the, you know, leave it alone territory for soaps and things like that, because I don't want anything like, you know, staying in. But, you know, also the importance of like folding that back, you know, and cleaning it out. And seeing if you take scents in there, seeing if the discharge, if you, when you wipe, you know, you see something on your rag or your bath gloves or your sapple or your hand, whatever it is. I wanted to not say loofahs because I'm discouraging discouraging it, right? So it's like, you know, there's so much messaging about why we need to be essentially afraid of our vaginas, but that is sometimes what causes us to miss, you know, signs of things that we should get checked out, or what causes things to go on longer than, you know, they need to. And sometimes, yeah, sometimes it's the shame, because if people online talking about me, you know, it's like it's gonna be hard for me to be like, okay, I'm gonna go to a doctor, to whatever. A lot of times the result, or what people resort to, is self-medicating, like the garlic, like the douching, like going to the beach every day to see if that could help to, you know, clear things out. So I would just like really suggest that we kind of cool on the harsh critiques. Like, if you are genuinely concerned about something, I feel like if you're not the person, I can't see you going up to them to tell them that they have an odor that they perhaps should be concerned about. But if you do know the person and you do notice something like BV, for example, that sometimes that smell can sometimes travel. And I say that as somebody who has, unfortunately, you know, somebody who has had it, like that smell travels. How do you treat things like that? How do you treat do you recommend that people self-treat? Or how do you medically treat things like yeast infections, BV? I mean, you talked about trichomoniasis and things that might be caused by sexually, you know, transmitted infections. So not necessarily those ones, but like BV and yeast infections and so on that are...
You know, you can't treat them by yourself.
Okay, so you can't treat them by yourself. Not that I thought that you could, but you can't treat them by yourself.
Well,
so go and beach answer, because somebody told me that when they have a yeast infection or feel one coming on, they go beach and it clears it right up. True or false? Possible or not possible?
It's difficult to say, but leaning more towards not possible. Because maybe when they come from the beach, the symptoms and
they feel relief,
severe, but it doesn't mean the infection has cleared up. So you usually don't need treatment for yeast infection. We use antifungal treatments because yeast is basically a fungus. And for BV, or bacterial vaginosis, we use antibiotics. Same for trichomoniasis. And for sometimes we suspect, a lot of the times, people have what we call multiple infections. So you have a lot of different infections going on at the same time. It's very common to have yeast infection together with BV and maybe trichomoniasis sometimes, as well as chlamydia and gonorrhea. Some people have all of them, and that's one of the reasons why when a patient presents with one, we ask them to screen for everything. And sometimes we may just go ahead and treat for multiple ones because sometimes they can come together. So for example, what is very common is that a patient may have a discharge and they may have self-medicated, they may have gotten some sort of antifungal medication, whether it's a cream or a tablet from the pharmacist, for example.
You mean like over the counter?
Over the counter. So they may see an improvement a little bit, but then it hasn't completely gone away because the BV part is still there. So then when you treat that part with the antibiotics, that's when they may notice the discharge completely clears up. So that's very common for people to have a group of infections together, and sometimes they may only get one treated. So sometimes we go ahead and treat different things because you may not do the test for chlamydia, but sometimes we treat for that too. It just depends. So when you talk to your doctor, they may get more information. Sometimes when we do an examination, we may get more information. But that is something I've noticed that people don't realize, that sometimes it's not only one thing that's happening, it's a bunch of different things, and sometimes everything needs to be treated. That's why you may see a slight improvement, but it doesn't completely go away. And on that note, it's also important to remember that you can reinfect yourself. So you may have an infection or multiple that you get treated, but your partner has it and was never treated. So you may notice your symptoms improve, and then a month later, the symptoms return because you've gone back to the same untreated partner and reinfected yourself as well. So that's also something that happens commonly.
Okay, and what does that apply to? Yeast, BV?
Right, so everything, yeast, BV, trichomoniasis, chlamydia, gonorrhea.
If you are treated, your partner should be treated.
Your partner should be treated, especially if you are having unprotected sex.
Okay, got you. So we heard that, right? So because I think sometimes we do think that the cause and concern is only inside or with the vagina. So I really appreciate that you said that it's important for the partner to also get treated, because the partner can also harbor those bacteria that cause those infections.
And I didn't get to touch on the common symptoms for men, or the red flags for men. But a lot of the time, especially if they have gonorrhea, they may develop a penile discharge. So it's like could be yellowish, whitish, greenish, pus-like discharge from the penis. And they also may notice a lot of burning when they pass in urine. That can also happen in women as well. But women usually get more symptoms when they have an infection compared to men. But by the time a man has that discharge, the infection is already in some ways more severe and definitely needs treatment.
Okay. So if a man has a yeast infection, how would that show up? Would it show up? Would there be symptoms?
A lot of them don't really have symptoms, but they may have the burning when they pass urine. Some of them may have a discharge, and some of them may have like itchy white stuff on the shaft itself. But those are more rare. Yeah.
Okay. So you did talk about the treatments that are typically prescribed, and I also love the encouragement to go to your doctor. I'm going to say especially if it's persistent, so as in you've attempted to treat it with medication and it is still there, because I know like yeast infections are so common that one, you could get treatment over the counter, so you don't have to see a doctor to access treatment. And two, like it's so common that I think a lot of people go that route instead of going doctor first route, right? Because I think, for some people it could be like you access the over the counter medication and that, that's all that you needed. But if you need something more, don't be afraid to go to your doctor, because the time that you spend like trying to treat it just prolongs the thing, because a lot of like you really can't treat it on your own. You really do need medical intervention, and doctors are trained to deal with these things, right? So it's like maybe I have been lucky. I don't know what other doctors might be like, but when I have gone to doctors about concerns with my vagina and so on, they've all been very confidential, very sensitive. Actually, except this one time, thank him, at UE. this doctor there, she was terrible. But aside from that, all the doctors here that I've gone to, and I've been to a few, from like general practitioners to gynecologists, and they have all been very like, first of all, they don't even react, because it's like you're not the first, you're not gonna be the last. Like you think you is the only vagina that come in with this thing, you're not. So it's like, yeah, here.
It's like
This is yeah, like I have seen this probably already multiple times for the day, right? So it's like we can't let people shame us into not getting ourselves treated for things and not accessing optimum, forms of health and wellness. Like we have to take charge of our own bodies. And yeah, I mean, if somebody but we need to start abusing people who talking about people. We need to start.
You mean regular?
Yeah, just
people in
regular people
society?
who like who talking about how people smell and stuff. And of course, like your typical hygiene practices are important. Like bathing is important. I know that the deodorant that I use, sometimes I might pass you and you might be like, because I'm using like, a Arm& Hammer. You could actually, they probably won't sponsor me if I'm saying that it's not that, it doesn't last that long.
Okay.
But it works for me. And if you're in a situation like that, then you might just need to bathe more often, or you might need to reapply more frequently, or whatever it is, right? But I think that, because we expect everybody to smell like Bath and Body Works, sometimes, like even a neutral scent, people can have a reaction to, and it's like, that's what
We're not used to
regular, like just
scents
nothing,
anymore.
like you started out by saying like scents are a big thing now, whether it is layering your scents or whatever, like people do expect you to smell like peaches and roses, and that's just not
And
not
it's
how it works.
person's preference.
Yeah, just not how that's just not how it works. Okay, so we've talked about a few things. We've talked about, some of the irregular smells that people might have. We've talked about the kinds of odors to look out for that might be an indication that you might need to seek medical help, and other symptoms that might come with it. We've also talked about douching and feminine washes and the absence of masculine washes and the reinforcement of misogyny. And we have talked about, cleaning ourselves and kind of the best ways to do it. But I want to leave people with that. Like, especially in relation to their genital areas. Talk to us about the ideal ways to keep ourselves clean. Like, what do they teach you in med school?
About keeping genitals clean.
Yeah, keeping ourselves clean.
You should clean regularly, ideally daily. That
Mm-hmm.
would be good because it's especially us who live in a warm, hot climate. You know, cleaning regularly, cleaning properly, cleaning with soap, for example. That's not going to cause more harm than good. And observing, for what is your normal, so that you can pick out when something is abnormal, and encouraging people to get treated when they notice something is abnormal or very concerning
Mm-hmm.
to them.
Okay. And that also means, sorry, were you?
No, go ahead.
That also means like peeling back the folds, getting into the cracks and crevices. Um, some people talk about using warm water. Everybody don't go hot water. So
I mean, in the regular temperature,
temperature
pipe
water
is
is fine. Using a clean rag or whatever it is you use, making sure that is clean when you are
if you're using
if
it.
you're using it.
Making sure your hands are clean.
Yeah, when you're
them.
especially if you're using your hands to clean your genital areas. I think even before we go into the shower, it means things like wiping properly, wiping front to back for people with vaginas, because sometimes wiping back to front can also be what causes some of the issues.
Some men can wipe as well. I know some men who prefer
to wipe.
I know some men, they shake and that's enough, but some are very sensitive. They don't want even, just like how we don't want urine in our underwear, they don't want any urine in their underwear. So some tap with napkin tissue as well.
Wiping when you go number 2 properly. Or some people like to jump into the bath and wash after. That's also
once you clean up.
Once you are cleaning yourself well, once you are washing your hands after dealing with your number 2 and not going to touch people. And anything else?
You had mentioned a few things. I wanted to just reiterate those in terms of normalizing. Let's normalize, especially for persons with vaginas, that we look at our vaginas. You were saying that some women want to disconnect, out of sight, out of mind. We just use it. I use it for number 1 and for pleasure, and that's it. They don't want to take a look. Let's normalize looking regularly so we can notice any changes, and that's okay. You don't always have to depend on your partner to tell you, hey, there's something strange, because sometimes they don't want to be offend you, so they don't say anything.
Right.
For your own health, let's normalize looking, and so that if there's anything that you're worried about, you can pick it up. And normalize going to the doctor when there's a problem down in the genital area, because persons are very shy, persons are very concerned, they don't want to deal with it, so they prefer to just stay at home and hope for the best, and that's how they end up trying all sorts of home remedies. So it's not
I'm going on Google and TikTok and Instagram, where they have everything except the helpful things usually, or everything except what you need.
Right. So normalize going to the doctor when you have a problem in the genital, whether you're you have a vagina or a penis. Let's normalize for persons with vaginas, women, going to doctors who are male. That's also another problem. People are very hesitant. If it is a doctor, is a man, they don't want to deal with that. And it's understandable because, of history of, you know, abuse in society with men. But your doctor is a professional who is looking out for your best interest. So that's those two things I wanted to touch on when you brought them up.
Thank you. Thank you. I appreciate your additions. And yeah, I just, would reiterate for the third time all of those things. Because, and that is also part of removing the stigma around, sex, around bodies, around body parts, and so on. Because I could also imagine a young person who is dealing with these things, who maybe is sexually active, maybe isn't, right? And they are like, I'm afraid to go to my parent about this because I know I'm not sexually active, but this is something associated with sex, so they might not believe me when you are sexually active and this might be the thing that outs you to your parents, so you're trying to deal with it, because you feel scared about going to them. Like, let's create spaces where people can, if there's an issue, get help for that issue and not be denied help because they're afraid of seeking it. Like, we should not be afraid or ashamed of seeking help. Because, like I said, here in the first, ain't gonna be the last. It could be a teachable moment. We could use it to talk about hygiene. We could use it to talk about, okay, well, let's see if there was anything that you can change the next time to, potentially avoid or prevent this outcome. So it's like, it's space for conversation, but it's definitely not space for shaming or to reinforce like those harmful ideas and that stigma around, especially vaginas. Anyways, we have come to and past the end of the show. I wanted to give you an opportunity to tell people where they can find you or follow you. I find you at the clinic, and I also find you in your private practice. I also know that you're on Facebook, so tell people. I just tell people where they can find you, but you tell them where specifically.
Okay, you can find me. My practice is at the Medical Associates building on Victoria Road. You can follow me on social media, Facebook, Dr. J. Matthew, Instagram, Dr. J. Matthew, and at www.drjmatthew.com.
Thank you. I will continue to do all of the above. As I mentioned, he's one of my favorite doctors, and I think it's because you're very understanding and you are very patient with me, cause I always have something and I always trying to explain it in Grey's Anatomy terms, and you let me do that and try to figure out like, okay, what is really happening, and I appreciate that. So follow her online, and if you need a doctor, you're taking patients, right?
Yes.
Okay, so check her out. Thank you so much for joining me for this.
Thank you for having me. I had a great time.
Thank you. Yeah, and thank you all for joining us and listening into this conversation. And if you are in the position where you are feeling seen and heard, or you were feeling seen and heard by something that we said, or if you know somebody who maybe you have sensed something or noticed something with them and you don't quite know how to approach them, approach it with sensitivity, thoughtfulness, because it is not only a sensitive area, it is a sensitive topic.
And you would want the same.
And you would want the same, right? Like, you would want somebody to approach you with kindness and yeah, mindfulness, sensitivity, quiet, privacy, and so on. So I encourage all of us to be more mindful about how we talk about other people, be more mindful about how we treat our bodies and what we tell other people when it comes to, or what we teach other people when it comes to um, caring for and keeping themselves and other people clean. And I mean literally clean. And yeah, just thank you for joining me for this conversation. I'm looking forward to what we will get into next week. And as usual, I'll wish you a pleasurable evening, and I will see you all next time. Bye.